You're watching a special edition of the CMR COVID Spotlight. And the topic that we're going to discuss now is how schools should prepare for COVID-19. And I brought on Jennifer Sparano. And Jennifer, I'm going to ask you to now tell our viewers a little bit of what you do and why you think I brought you on.
Hi, how are you? I hope everybody's doing well. As Kevin said, my name is Jennifer Sparano. I am the Director of Administration COVID Response for Hillsborough County Public Schools, which is in the Tampa Bay area of Florida.
And so your school district that you oversee, the COVID response for the schools, is a pretty big one, right? Where do we rank in the state and the nation?
Yeah, Kevin. So Hillsborough County Public Schools is the third largest school district in Florida and the seventh largest school district in the United States. So we have in this one county over 280 school sites, and that's a mix of regular public schools and charter schools that serve pre-K through adult career centers.
How many students is that in all?
It's approximately 230,000 students.
So it's a lot of kids a lot of students that you are really responsible for ensuring that they're safe, and especially with a new element with the pandemic, that's a lot of potential of sick children. And so, we were talking and explaining, the Cayman Islands is starting to see a lot of outbreaks, especially within school settings. We got a really large population that is vaccinated, but of course, those younger kids, they're not eligible right now, and so they're the ones really getting COVID. And so, just kind of discussing a little bit of some of the observations that you've had within Hillsborough County schools and masking, because that's one of those hot topics that everywhere in the world has either people for, against, or what was it like when you had a lot of students required to wear masks, or does it really help?
So that's a great question. And fortunately, I've been in this position since we came back to school in July of 2020. So our schools shut down in March of 2020, and we finished the school year remotely. I was a high school principal. In the Cayman Islands, you might call it like a headmaster. And then I transitioned to this role in July, which is when schools came back. And so during that time, we've learned a lot about mitigation strategies, and masking is a key component of mitigation, which is preventing the spread of COVID. So we know last year that while masking was universally practiced, except for a few students who had special needs or special medical considerations, the spread was very, very much contained. And we know that starting this school year without a mandatory mask mandate during the surge, it was extremely challenging. We logged thousands of cases of positive students. And when we reinstated a mask mandate, we were able to see improvement in that spread and those positivity rates. Now, consequently, our community was also seeing a drop in COVID cases, but I'm a firm believer that the strategies work together, and that the impact that our school practices, the impact of our school practices was felt in the community.
Gotcha. What about air filters? Did you guys use a lot of them in the schools, or wasn't something that you guys really invested in?
So yes, we absolutely invested in it. We were very fortunate to be able to use federal funding and state funding to put MERV 3 filters in all of our schools. So we bumped up our filtration. We had all of the layered mitigation strategies: masking, regular sanitizing, regular cleaning of high touch surfaces, and entire school communities participated in that. It wasn't just our custodial staff, but teachers and students wiped down their areas on a regular basis. We made sure that students hand washed. We are continue to be adamant about people who are symptomatic, not just students, but employees also staying home. We don't know at the onset whether some of the symptoms are cold symptoms or COVID symptoms because they're so similar. So it is key that symptomatic people stay home.
Got it. And what about opening windows? Did you guys have an opportunity to have classrooms with open windows, or that's just not available in most of the schools?
So it's been super hot here. We're in, what would most states or most places would consider to be all autumn or fall. And so I would say teachers did try to crack windows from time to time, but in most of our buildings, any fluctuation in the humidity in the classrooms would cause our air conditioning systems to act up. So we were not able to use a lot of the fresh air and the ventilation strategies that are recommended, but we did try to have as many activities as we could with students outdoors.
And what about lunchtime? How did you handle that? I'm sure, you have a bunch of classes going on break at the same time, very crowded lunchroom. How was that managed?
So lunch continues to be a challenge. During last school year, where parents had an option to continue remote learning or to send their students back to school, we had smaller amounts of students in school. But this year, that option is not available. Parents are not able to keep their students home, keep them enrolled in their regular school, and do remote learning. So our lunchrooms are very crowded. And you're exactly right. In a high school where you have 2,000 students and 3 50-minute periods to feed them, you're going to have 700-ish students in the lunchroom at one time. So while last year we tried to stagger, we made sure we staggered seating and we marked off seats so that students couldn't sit in them and they had to sit at least 3 feet apart in the lunchroom. That's pretty much the best that we could do. This year, we're not able to do that. So other things that we have put into place is we are trying to compensate teachers in other ways if they agree to allow students to eat in their classrooms during their planning period or during their lunch period. We try to either flex their time or give them some kind of compensation to help give us more space. In schools where we have outdoor patios, we also try to make sure we have proper supervision and bring some students outside. There were a few schools that were able to create different schedules for lunch, but our school day is pretty tight and we're required to have a certain amount of minutes of instruction. So that strategy was pretty limited.
Now, in terms of classroom size, were you able to really, they have different, depending on which guidance you're using, somewhere between 3 to 6 feet in between students. Is that even possible in most of your schools? And what's been done on that front?
So when you start off in the elementary school, the grade level, the grade school, and then you move up, it gets increasingly difficult as the children get older to have that space. So one of the strategies that we used was having teachers set up their classroom in advance of school starting and just doing a building audit, and administrators would walk through and look at the classrooms and offer suggestions on how to maximize space to create as much distance between students as possible. Even back to last year, we have removed all non-essential furniture from classrooms. So any extra bookshelves, any extra furniture that's just not needed to try to maximize space. But the reality is, Kevin, in high schools, if we can get them 3 feet apart, that's great. Elementary schools, it's a little bit more feasible. And our teachers have had to sacrifice some of those awesome learning arrangements that they would love to have with their students, where students sit in groups. They've had to sacrifice that to some traditional seating in order to keep students safe. So in the high schools and in the grades where it's even more crowded, the mitigation strategies are even more crucial.
And what about vaccination requirements or teachers? Because, there's a lot of data that says, hey, teachers are also contributing to potentially transferring of the virus to the students. Are teachers required to be vaccinated?
So in our state right now, there are no vaccination requirements. There are some states, however, where teachers are being required to vaccinate. In New York City, for example, they are being required to vaccinate, and if they don't vaccinate, right now they're not allowed to work. But we don't have any requirements for teachers to vaccinate. However, many teachers understand the science, they understand the benefit of vaccination, and in some cases they just understand that they're going to be missing work and they're not going to be able to provide the education to our students that they need. So they know that vaccination is going to be key for keeping them at school and not requiring them to quarantine.
Yeah, and everyone has only so many vacation days, and when you run out, and then it starts to hit the pocket. So it's also something that some people have to think about when it comes to, hey, you're going to be exposed a lot, because you can't completely keep COVID out of the schools.
That's correct.
You can do the absolute best. You could be on top of making sure you're sanitizing and doing your best to social distance, but at the same time, it's just not possible to completely keep out, and so your risk really does go up.
It absolutely does. I think that financial impact has had has been a big influence for teachers. And also, we have many families here that take care of older relatives, and so they also have a sense of responsibility to their families, and knowing that there are around 150 children every day and that they are at a higher risk for bringing the virus home. I think that that's a big motivator as well.
Now, have you had a lot of teachers getting sick, a lot of staff, not necessarily just teachers, because schools are made up of more than just teachers? So did you have a lot of staff get sick from COVID or even die from COVID?
So, from our perspective, any death of anybody in our school community, even though we're a big school district, is not acceptable. And so whether or not you would consider it a lot based on the size of our employee base, I don't know, but we've had about 12 employees of various professions with various roles in our school district pass away since the beginning of the pandemic. Student nutrition workers, custodial staff, teachers, bus drivers, bus attendants. We have definitely suffered some loss, and we have also experienced the death of a couple of students. Was it attributed to COVID at the time? No, but there's definitely some investigation taking place since August 2nd, when most teachers report back to work. We have logged 4,000 positive cases of employees and over 15,000 positive cases in students.
In terms of percentages, because the Cayman Islands have a much smaller percentages, do you know kind of what percentage of the student body as well as the employee body that represents?
So our current total population of students, I was a little off, it's 243,000 students. So our enrollment goes up a little bit over the year as people move around and relocate. So out of 243,000 students, we've had 15,000 students test positive, who have reported to us that they've tested positive or who have received a positive test. There could be 100 or more other students who were just symptomatic and spent 10 days home and their parents didn't test them. Yeah. So percentage wise, I was an English teacher, so yes. I would have to defer to my calculator.
Gotcha, no problem. And what about talk to us what happens when you do have a positive case? There's a lot of contact tracing that goes on. I know that you've trained a lot of the staff to carry out the contact tracing to help us at the health department, because we just don't have the manpower or the people power to really carry out so many investigations. It's just not possible. In the Cayman Islands, they call it public health, is the body that would come in and investigate and do contact tracing. So what were some of the things that Hillsborough County did in order to make sure we quickly identify these cases and get them into quarantine or isolation?
So I think what was key from the beginning, so in 2020, was developing that relationship with the Department of Health or developing that relationship with public health. Schools have to have that good relationship, that open communication, because if it weren't for that relationship, I wouldn't have received the training that I did from the Department of Health or what you identified as public health in Grand Cayman. And I then in turn wouldn't have been able to train school staff. So I identified pretty early on, having been a principal, that with just the sheer amount of students in school sites and buildings, because we have other buildings that don't have students in them, right? We have district offices and garages and warehouses, that there was no way the Department of Health would be able to do it on their own. And that if we wanted to do it efficiently and quickly, because that's key, is identifying close contacts and getting them to quarantine right away, that if we wanted to do that, the schools had to have a role. So the protocol has actually developed, and been fine-tuned over the course of the last 15 months. We've grown and learned together, the Department of Health and the school district. We've tried things that didn't work, and we've tried other things that did, and we have a really amazing protocol. So I'm just going to focus on school sites, but school sites have seating charts for every time period of the day that students are in the building. They have seating charts for classroom time, and they have seating charts for lunch. There are seating charts on the bus. There are groupings and seating charts for after school care if that's offered at the school. And those are key to tracing. So when there is a positive case, we are able to quickly identify who the close contacts of that positive student were. Let's use a student during their infectious period, which is 48 hours before symptoms start. And then from there, the school staff, gets together. There are people who are identified as the COVID leads at each school site, and they mobilize to call the parents and to make that contact and let them know that their children have been exposed, and to provide them with the dates for quarantine, to give them testing resources, to give them their learning materials for the time that they're going to be quarantined. And then they also put all the documentation together, send it to me, and I send it to the Department of Health, so that the Department of Health or Public Health can log all the public health records and continue the investigation.
Okay. And COVID this year compared to last year, how is it different?
So one of the things I mentioned is we have a lot more students in school. So that has been very challenging. And our school district had to make some pretty substantial budget cuts as well. So we had to cut back on teachers, which also resulted in having more students in class. So that was very challenging. And then we were faced with an extremely contagious variant, which was Delta, and it spread like wildfire, especially in households. So COVID has always spread pretty efficiently in households based on my experience, but Delta was very efficient. And we also had a lot more school spread with Delta than we had last year with the original strain. So more students in school, fewer adults, and a very contagious strain of COVID, combined with some community resources that weren't fully developed at the time that we hit our peak, combined with some rules that were communicated to schools from our state government that the local community wasn't prepared for. So students were given an option to test out of quarantine this school year, where they weren't given that option last year. And our local resources were not prepared at the time that that decision was announced. So students had the option to test 5 days after exposure to return to school. And our public health department wasn't ready. They didn't know the decision was coming because state government kind of did it pretty quickly and without a lot of communication. So there's been a lot of differences, Kevin, to be honest with you. And I think that the media coverage and the severity that Delta impacted people, I think had people more on edge this year than last year. And so I think there's been more of an emotional component this year.
Now, just speaking on the emotional component, mental health really does impact a lot of students, especially with the stresses of what the pandemic brought. How is that being handled in your school district, as well as, are you seeing a lot more situations where we have to increase counseling services for children?
It's difficult to say whether it's because of COVID, but I would say that emotionally, students are more stretched this year. I think that we are seeing evidence that things are different. Was it because they spent all last year at home and they weren't socializing with their friends, and the adjustment back to face-to-face instruction, is challenging for them? It could be. Could it be the loss of one of their family members to COVID, or their parents losing their job at some point because of the pandemic and they're still trying to regain their financial footing? That could also be a reason that some students are experiencing some emotional or mental anguish. Could they have suffered some learning loss while they spent that time at home? And now that they're back in school, they're struggling to catch up academically. All of those things are definitely factors. And so we have definitely added additional resources. I wouldn't say that it's specifically because of COVID. I think that as a country, as a nation, as a world, we are a lot more cognizant of mental health and the need to provide services for students. So I think it all kind of happened at the right time.
And then one of the next things is, and we touched on it going back to, whether a student's life was lost, or even a staff member, students build relationships. And if they're ever put in a situation where someone lost their life, especially because of COVID, that in itself could bring on a lot of extra stresses. And I know here they have counselors that like a team that goes in anytime there's a death. And so schools definitely need to be prepared should that happen. We don't want that to happen. And in Cayman Islands, just like Florida, we are subject to hurricanes. And just, you prepare for a hurricane. Right now, schools need to prepare for if you have an unfortunate situation like the death of a staff member in a school. So something that definitely needs to be in the plans as, you're figuring out, how am I going to address certain situations? You can't forget about that.
I would agree. And I would add to that, not to forget that some students don't eat when they're not able to come to school. And so making sure that there's that follow up and follow through about that human need as well. Like you're speaking about that emotional need and making sure we take care of that. Another one of Maslow's, needs is food. And so keeping in mind that while a student is isolated or quarantined, whether it's because of school exposure or community exposure, that we have to make sure we have that open line of communication. We can provide resources for them, and food is one of those. I don't know if Grand Cayman has something set up for that, but we have begun to have pickup locations for parents. Well, we began months ago, so that if their student is isolated or quarantined and they depend on the school food program, they can still get nutrition.
And as we start to wrap things up, Jennifer, what advice would you have for the people of the Cayman Islands as things start to evolve?
So be strong, my friends. This is part of it's a journey that we're on as a world, and we are all communities, even if we're across the ocean from each other. So just be strong and support each other. Just know that public health and the Ministry of Education are on the same side. You're on the same team, and you're all fighting for the same thing, which is the best education that you can provide for students and the best work environment that you can provide for your educational professionals. So just don't give up the fight. Just be continuously mindful about safety and what you can do to keep children safe, and know that these steps and these mitigation strategies that you're putting into place, it's not it's not just about death. It's about if they're not at school, they're not learning the same way. The best place for them to be, to get their education, to get that emotional support, to get the nutrition, to get the socialization, to get the physical activity is in your building. So every time that you come up with a plan to keep them from contracting COVID or any other virus, is another day they'll be in school getting all of those things from you.
Really appreciate you taking the time, Jennifer. Thank you very much. The people of the Cayman Islands also thank you very much for sharing your experiences.
Thank you. Be safe, everyone, and